It was September 28, 1928, in the heart of London. Amidst the busy halls of St Mary's Hospital, Professor Fleming, a Scottish bacteriologist, began the routine task of sorting through his petri dishes, when something unusual caught his keen eye. The mold in one of the dishes had created a clear space where bacteria could not grow. From that blessed day, the story of antibiotics began, forever altering the landscape of medicine and saving countless lives. As he received the Nobel Prize in 1945, Professor Fleming warned against misuse of penicillin. He stated, "It is not difficult to make microbes resistant to penicillin in the laboratory by exposing them to concentrations not sufficient to kill them. And the same thing has occasionally happened in the body. The time may come when penicillin can be bought by anyone in the shops. Then there is the danger that the ignorant man may easily underdose himself, and by exposing his microbes to non-lethal quantities of the drug, make them resistant." Today, antimicrobial resistance is the silent pandemic. The misuse of antibiotics has led to antimicrobial resistance. An estimated 700,000 people, including 214,000 newborns, lose lives to resistant infections every year globally. By 2050, up to 10 million people a year could die from drug-resistant infections, jeopardizing the global economy by $100 trillion. Antimicrobial resistance is a global threat for human health, the well-being of animals, and the environment. Pakistan is the third largest consumer of antibiotics in low to middle income countries. An estimated 50% of these antibiotics are inappropriately prescribed. Animals consume 3 times more antibiotics than humans, and antibiotic-resistant genes have been found in environmental samples as well in Pakistan. To counter this silent threat, the world is now working on One Health approach. In other words, achieving health outcomes by recognizing the linkage between people, animals, and the environment, realizing the growing and serious impact of antimicrobial resistance globally. The UK Department of Health and Social Care established the Fleming Fund in 2015. The £265 million fund works in collaboration with global partners and governments in 25 countries across Africa and Asia for countering the menace of antimicrobial resistance. In April 2018, the Fleming Fund started working in Pakistan. Led by DAI, the project has been implemented in collaboration with the Indus Hospital, Aga Khan University, Health Security Partners, and Liverpool School of Tropical Medicine.
The journey of antimicrobial resistance through the Fleming Fund started in 2018 in Pakistan, when the UK government decided to send a scoping mission to Pakistan in order to find out the magnitude of the problem of antimicrobial resistance in Pakistan. Before that, the government of Pakistan had already developed a national action plan on AMR. And in order to support and to execute that plan, Fleming Fund Country Grant Pakistan was executed and implementing since 2019 in Pakistan. The idea is to strengthen the surveillance system of Pakistan and also strengthen the laboratories in Pakistan so they are able to detect the resistance and they are able to identify the resistance pattern. The unique thing about this program is the One Health approach, which means this program is not only working for the human health but also with the animal health sectors and also the environment.
The project works closely with the federal and provincial public health institutions on addressing antimicrobial resistance in Pakistan. The project particularly focused on strengthening the 3 national reference laboratories, which include human health, animal health, and poultry sector. This included ISO certifications, biosafety assessments, development of maiden biorepository inventory management system, and improving infrastructures of 10 microbiology laboratories in the 4 provinces, along with AJK and Gilgit-Baltistan. The National Institute of Health is one of the leading partners with Fleming Fund in Pakistan.
One of our important health development partner is Fleming Fund. They have been supporting the National Action Plan implementation in several areas. Importantly, support for establishing sentinel laboratories, developing sentinel surveillance strategy, and establishment of national reference laboratories, one in human health sector and two in the veterinary and livestock sector. And especially, I would especially like to mention their support in the process of ISO certification of our laboratory at National Institute of Health, which is now ISO 15189 certified lab.
The project has also assisted the National Veterinary Laboratory in establishing the AMR surveillance systems and getting ISO certification for foot and mouth disease in animals.
Fleming Fund grant supported us in many perspectives. They were having two animal reference labs. So in the phase 1, which is nearly completed, Fleming Fund grant supported with the trainings, equipment, refurbishment, and many other aspects relating to the development of surveillance plan, which was very needed under the National Action Plan for the AMR. All these things contributed to the development of the data, which is very much important when we show up our work to the policymakers for taking up actions against stopping this AMR issue, which is spreading day by day.
National Reference Laboratory for Poultry Diseases is the National Poultry Reference Lab of Pakistan and is linked to poultry surveillance sites across the country. The laboratory was refurbished and equipped with the needed tools for AMR surveillance and was also supported by the program to obtain a viral diagnostic certification.
We actually established a coordination unit in the Animal Husbandry Commissioner Office in Pakistan in this ministry, and under that particular coordination unit, we actually coordinated all that activities that we have in this program. Like for example, we achieved some of the national surveillance strategies we developed for healthy food animal, for sick animal, even for environment or even for the aquaculture, and specifically for the human laboratories, we developed some of the policies and guidelines for the veterinarian.
Islamabad Healthcare Regulatory Authority, also called IHRA, is an autonomous health regulatory body that aims to improve the quality, efficiency, and safety of healthcare services within the Islamabad Capital Territory. The country grant collaborated with the IHRA to organize a 3-day training on AMR stewardship for health professionals in Islamabad's public and private sector hospitals. Fleming Fund is also facilitating IHRA in the development of antimicrobial stewardship regulations. The project has backed its work with groundbreaking research on antimicrobial resistance in Pakistan. It mainly focused on antimicrobial surveillance. The research surveys are a baseline for the policymakers and healthcare professionals for addressing antimicrobial resistance. The Point Prevalence Survey provided information on a cross-sectional audit of antimicrobial use in hospitals. Additionally, a meta-analysis and the detailed AMR consumption analysis were carried out across Pakistan. Dashboards showcasing key antimicrobial indicators have been developed for Khyber Pakhtunkhwa and Sindh. The project conducted the first ever antibiotics consumption trend analysis in human health sector for the years 2019 to 2021. This large-scale research study provides evidence for the impact of COVID-19 on consumption of antibiotics in Pakistan. The project has also conducted antibiotic footprint analysis for animal and human health in Pakistan. This research work became the basis for reaching out to people, informing them about the dangers of antimicrobial resistance. In November every year, the project arranges activities to mark the World Antimicrobial Awareness Week. This included seminars, competitions, symposiums, outreach events, as celebrities from the showbiz are engaged for wider dissemination of information and to endorse the cause of antimicrobial resistance.
International Fleming Fund has been instrumental in helping us out to combat this threat and to deal with antimicrobial resistance. We had signed an MOU with the International Fleming Fund in 2022, and that through that process we have been able to upgrade the clinical facility, the laboratory facilities, the testing facilities, and different processes that are involved in managing the antimicrobial resistance in a proper way. Currently we are also ISO certified, which was done in 2023, and that too is through the help of the International Fleming Fund. Together, International Fleming Fund and JPMC are trying to establish a clinical excellence laboratory and two device practices that we can help advise to other hospitals and other clinical centers to follow and to avoid antimicrobial resistance.
The Fleming Fund Country Grant Pakistan's Clinical Engagement Program was recognized for its excellence and awarded the prestigious 2022 Stewardship Prize by the AMR Industry Alliance. The program was selected as the global best practice for bringing antimicrobial resistance awareness to the forefront of clinical care.
और इन्होंने एंटी माइक्रोबियल सेल डायरेक्टरेट में बनाया और इन्होंने जाके हमें 2 मेन हॉस्पिटल में KTH में और HMC में स्टेट ऑफ द आर्ट जो लेबॉर्ट्रीज बनाए हैं, जिससे हमें बहुत इंशाल्लाह इसमें इससे वैल्यू एडिशन पर दी हेल्थ डिपार्टमेंट। तीसरा, इन्होंने जो AMR जो एंटी माइक्रोबियल जो डैशबोर्ड बनाया हुआ है, इससे हमें ये फ़ायदा होगा कि इससे रियल टाइम जो डाटा है उसमें हमें इंफॉर्मेशन हमें इंशाल्लाह उससे देगा।
Laboratory support is another corner that we had to work in, and with the support of Fleming again, we've been able to upgrade and get ISO certification of JPMC and civil hospital labs.
Support provided by the Fleming Fund Country Grant has yielded numerous benefits. Investments in laboratories have enhanced data availability for surveillance, ensuring better control over the quality and quantity of lab tests. The shift towards public labs has reduced expenses for patients compared to private facilities. Healthcare practitioners have started considering evidence-based diagnosis rather than subjective observations. Knowledge dissemination among dairy farmers has been effective, leading to a decrease in self-medication and increased reliance on veterinary care for animal treatment. The development of policy documents has established a foundation for future strategic planning. Moreover, the economic burden has decreased with reduced hospital expenses in KP and Sindh. In 1951, Sir Fleming Alexander visited the Dow Medical College in Karachi. Decades later, as a tribute to the visionary pioneer of antibiotics, the Fleming Fund recreated that remarkable moment, symbolizing the link between the past and the present, and between the pioneer and the advocates of today for a healthy future.